going back next week. We worry about, social interactions. We worry about teachers and being able to learn and bullying and all of those kinds of things. But some people are also concerned that, we know the old story. When the kids all get together, it becomes a cesspool of germs and, it's just like a germ convention. Everybody gets together for fun, frivolity, except the kids who may end up getting sick. Dr. Dina Kulik is the assistant professor in the Department of Pediatrics of U of T and has kids going back to school next week, too. And I guess the problem, doctor, is when you're a doctor, you know too much.
That's it. For good and bad.
Yeah, it's like, I know these things are out there. Now what? So what are some of the common things that parents should be aware of that you see as a pediatrician on a regular basis?
I see all sorts of viruses every single day. So from the common cold and cough to stomach flu to pink eye infections to roseola to hand, foot, and mouth disease to asthma exacerbations.
Wow.
Really the whole gamut.
And you do see an uptick, right, come September because the kids are all together in a room.
Absolutely, yes. So people think it's because the weather is getting colder. That's not actually the case. Going outside without a hat, et cetera, is not actually a risk factor. But when kids are all together, like you say, it's a cesspool. They're not playing outside as much, so they're in a contained, closed space and breathing on each other and sometimes not using good hand hygiene. And so they're sharing stuff and they end up passing viruses back and forth.
We have 6 kids who have gone through school and grandkids going through school now. There are a few things I noticed that I think increased over the years. One of them is the ear infection. That seems to pop up a lot. Do you see a lot of that?
Oh, I see ear infections every day. I'm not sure that it's an increased incidence since we were kids, though. I personally had chronic ear infections when I was a kid and had them literally every single month when I was growing up. But certainly we see lots and lots of them now. It's just a bad luck thing. You get a cold, you get congestion throughout your nose and your sinuses and behind your eardrums, and that is a breeding ground for bacteria.
That's not something particularly that you can pass from kid to kid, though, right?
Not at all, no. Just the cold part of it you can pass, and then it's a bad luck kind of thing. How much bacteria do you grow in your eardrum or not?
Which ones are the most contagious? And again, we get into this discussion every year about, how sick do the kids have to be before you keep them home from school. Which ones do you see that are really contagious?
So certain viruses like hand, foot, and mouth disease, which cause pimples in the mouth and the hands and the feet, very, very contagious. Stomach flu, particularly contagious as well. Eye infections like pink eye, conjunctivitis we call it, and typical common cold stuff. So these are all viral infections that spread quite easily if you're not washing your hands enough or you're not covering your sneezes, those kinds of things.
I've heard and read that the particular strain of lice that's out there this year is a harder one to get rid of. And I don't know where I was reading the story the other day that there were a few popular over-the-counter medications that might not even work against it this year. Are you hearing that?
Yeah, that's absolutely true. So over time when we use different anti-lice medicines, the lice get smart and get tricky and start to mutate a bit, such that the typical remedies, I don't know if you've heard of Nix, that's a really common one, or something called Results, they're starting to get more resistant to those particular products, and therefore we end up seeing a rise in lice outbreaks in schools and daycares and camps and stuff. And
it doesn't mean, there's an awful stigma attached to that, isn't there? It doesn't mean that the kids are unclean or that there's a problem at home or anything. You can pick it up from anywhere.
100%, yeah. So lice likes hair. It doesn't care if it's clean. It doesn't care if it's dirty. Boy, girl, long hair, short hair. Lice just likes our hair. So no, there's no implication for how clean or dirty your child is. Again, it's a matter of sharing stuff and getting too close to someone that also has it.
Kids are, obviously you can't stop kids from getting sick. Where do you stand on this idea that part of the problem these days is that our kids are kept away from germs too much, that we've got to give them some exposure?
100%. So the evidence actually shows that kids that are kind of kept in a bubble, as it were, not exposed to viruses early on, actually have increased risk of having more significant illnesses later, particularly things like asthma and allergies, because they're kept too clean, too sterile. You actually want to make sure that your child is exposed to certain bacteria and viruses early on in life. Too sterile of an environment can actually be a bad thing. And, regardless, whenever it is your kid is going to get sick, they will get sick at some point when they get exposed to other kids, whether that's in the first year of life, if they get it from other little babies, or when they start daycare, or when they start grade 1. Whenever it is, your kid will get sick at some point. So exposing them early, it sucks if your baby gets sick, but they do develop an immune system that way when they are exposed.
Doctor, are there just some basic common sense things that parents can and should do as the kids go back to school that could avoid some of the more unnecessary things?
100%. The biggest thing is hand hygiene. You want to teach your kids to wash their hands often, not excessively, but, relatively often, particularly after playing outside or playing in dirty places like the sandbox or the playground, using soap and water, just simple soap and water, nothing fancy. You could use hand sanitizer, like alcohol washes, if you're out and about and it's an easier thing to do. But simple soap and water is a great thing, especially before eating, after playing, as I mentioned. And, avoiding sharing things with other kids. There's not really a big need to share your sippy cup or your utensils with other kids. And then covering your face, right? So teaching kids to cover their noses, covering their coughs, and stay home when you're sick. It's really quite obvious. If you're very sick, you don't want to expose your other friends and your colleagues to your illnesses. So stay home if you can, and that prevents the whole office from getting sick, the whole classroom from getting sick.
Good stuff. Doctor, a pleasure. Thank you.
Thank you.
Dr. Dina Kulik, Assistant Professor in the Department of Pediatrics at U.